fever, chills, body aches, and coughs. All the symptoms seem the same for a cold, the flu, and coronavirus, also known as COVID-19. How do you know the difference? Before we get started, please make sure to like, subscribe, and hit the bell icon for notifications. As Dr. Anthony Fauci, one of the top medical experts in Trump administration, said that coronavirus is 10 times more lethal than the seasonal flu. According to the World Health Organization, coronaviruses are grouped as a large family of viruses that can cause illnesses ranging from common cold to more severe diseases such as Middle East Respiratory Syndrome or MERS coronavirus and Severe Acute Respiratory Syndrome, SARS coronavirus. For more details on different types of major viruses, please make sure to watch the video in the description below. Viruses have many different strains. Common cold is a completely different strain than COVID-19. Most coronaviruses, such as the common cold, cause mild infections in the upper respiratory tract and produce relative minor symptoms such as stuffy nose, sore throat, and headaches. People who contract COVID-19 suffer from respiratory systems that can cause coughing, shortness of breath, difficulty breathing, and fever. The infection can also cause pneumonia, kidney failure, and in most serious cases, death. Flu is caused by a number of different influenza viruses. Flu is very infectious and also spreads easily to other people and is likely to be passed on by another person with the first 5 days of infection. In most serious cases, flu can also cause pneumonia. Common cold has symptoms usually that peak within the first 2 or 3 days of infection, while the effects of COVID-19 appear after 2 to 14 days of exposure. Coronavirus appears to spread more slowly than flu or common cold. This is probably the biggest difference between all three of them. The flu has a shorter incubation period. An incubation period is the time it takes for an affected person to show the symptoms. Flu also has a shorter serial interval, which means it's the time between successive cases. Contracting coronavirus can also lead to 2 or more secondary infections on average. However, when you get flu, it can cause secondary infections. Usually in rare cases, you get pneumonia. The World Health Organization warned the context is key, where someone who contracts coronavirus might already be fighting another condition, for example. While kids are usually the primary culprits for flu transmission, this COVID-19 seems to be passed between adults. That means adults are getting hit hardest, especially the ones that are older and have underlying medical conditions. So overall, coronavirus or COVID-19 is the most newest strain of viruses, so there is no cure for it yet. It is said to take at least 1 year to find a cure for it. Coronavirus attacks adults and is passed between adults more than young children, whereas flu and common cold, typically the younger children are more susceptible to it. So these were the differences between common cold, flu, and COVID-19 coronavirus. I hope this gets you a better understanding between COVID-19, common cold, and flu. Always make sure to wash your hands, keep yourself safe. If you have any symptoms of high fever, shortness of breath, cough, please make sure to consult your physician or doctor immediately. And I wish you the best of health. Take care and thank you for watching.